Let me ask you something. You're over 60, you're doing everything right. You eat reasonably well, you take your supplements, you go to your doctor for checkups. And one of those supplements sitting on your kitchen counter right now is probably vitamin D. Maybe your doctor even recommended it. Maybe you picked it up yourself because you read that it helps your bones, your immune system, your mood. And you figured, hey, it's just a vitamin. How dangerous could it be? Here's the thing, and I want you to really pay attention to this. There are two very common medications that millions of Americans over 60 take every single day, medications that seem completely unrelated to vitamin D, that when combined with your vitamin D supplement can quietly cause serious, life-altering damage to your body. We're talking about kidney problems, dangerous changes in your blood chemistry, heart rhythm disturbances, and in some cases, outcomes that land people in the emergency room. The scary part? Most people have absolutely no idea this is happening. There are no loud warning symptoms at first, no flashing red lights. Your body just slowly suffers in silence while you think you're doing something healthy. So if you're over 60 and you're taking vitamin D, and statistically speaking, there's a very good chance you are, you need to watch this video all the way through. Because what you're about to learn could genuinely protect your health, or possibly even your life. Now, before we get into the specific medications, I want you to understand why this issue is so much more serious for people over 60 than it is for younger adults. And this is something that most health content completely skips over, which is honestly a disservice to everyone watching. Your body at 60 is fundamentally different from your body at 35. Not worse, not broken, just different. And those differences matter enormously when it comes to how medications and supplements interact inside your system. After the age of 60, your kidneys naturally begin to filter blood more slowly. Your liver processes substances at a reduced rate. Your digestive system absorbs nutrients differently. And perhaps most importantly, your body's ability to regulate calcium, which is directly connected to vitamin D, becomes much more sensitive and much less forgiving. Now here's something that genuinely surprises most people. Vitamin D itself doesn't actually do anything useful in your body until it goes through a conversion process. When you swallow that vitamin D capsule, your liver first converts it into a substance called calcidiol, and then your kidneys convert that into the active, usable form called calcitriol. That active form is what actually signals your intestines to absorb calcium from your food and supplements. So vitamin D is essentially a control lever for calcium absorption. And when that lever gets stuck in the wrong position because of a medication interaction, your calcium levels can spike to dangerous levels without you feeling much of anything at first. And elevated calcium in the blood, doctors call it hypercalcemia, is not something to take lightly. It affects your heart, your kidneys, your muscles, your nervous system, and your mental clarity. For someone in their 30s with perfectly functioning kidneys, the body can often compensate and clear out excess calcium over time. For someone over 60 whose kidneys are already working at a slower pace, that correction doesn't happen as easily. The excess builds up, and that's when real problems begin. So let's talk about the first medication that should never be combined carelessly with vitamin D if you're over 60. And I want to be clear, I'm not asking you to throw away your prescriptions or stop anything without talking to your doctor. What I'm asking you to do is have a more informed conversation with your healthcare provider after watching this. The first medication is thiazide diuretics. You might know them by names like hydrochlorothiazide, which is often abbreviated HCDZ, or chlorthalidone. These are some of the most commonly prescribed blood pressure medications in the United States. According to data from major pharmacy benefit programs, hydrochlorothiazide alone is consistently among the top 10 most prescribed medications in the country year after year. So we're talking about an enormous number of people. Now here's the problem. Thiazide diuretics work by making your kidneys excrete more sodium and water, which lowers blood pressure. That's the intended effect, and it works well for many people. But here's the part that most people, and honestly even some doctors, don't emphasize enough. Thiazide diuretics also significantly reduce the amount of calcium that your kidneys flush out. In other words, they cause your kidneys to hold on to calcium rather than removing it from your blood. Now combine that with vitamin D, which is actively telling your intestines to absorb more calcium from everything you eat. You've got calcium being absorbed at an increased rate from one direction and calcium being retained by the kidneys from another direction. The result is that calcium levels in your blood can creep upward slowly and silently. This condition is sometimes referred to as thiazide-induced hypercalcemia, and it is particularly well documented in older adults. Research published in medical literature has shown that this interaction becomes significantly more risky as kidney function naturally declines with age. The symptoms when they do appear can include fatigue that you might chalk up to just getting older, constipation, increased thirst, frequent urination, brain fog, muscle weakness, and in more serious cases, kidney stones or irregular heart rhythms. Because these symptoms are so easy to dismiss as normal aging, people often go months without realizing that their calcium levels have been slowly climbing. And here's the part that genuinely concerns me as someone who studies this. Most people who are taking hydrochlorothiazide for blood pressure are also the exact same demographic who are most likely to be taking vitamin D supplements. They're over 60, they're health conscious, they've been told vitamin D is good for their bones. Nobody connected the dots for them. If you are on a thiazide diuretic and you are taking vitamin D, please make an appointment to have your serum calcium levels checked. It's a simple blood test. It's not expensive. And it could reveal something important about what's been happening quietly in your body. Now let's move to the second medication. And this one might surprise you even more because it seems completely unrelated to vitamins or calcium. The second medication category is cardiac glycosides, most commonly represented by a drug called digoxin. Digoxin has been used to treat heart failure and certain types of irregular heart rhythms for well over a century. It remains in use today, particularly among older adults, because it helps the heart beat more effectively and helps control certain arrhythmias. And here's where things get genuinely dangerous. Digoxin has an extremely narrow therapeutic window. That phrase means that the difference between the amount of digoxin that helps you and the amount that harms you is very, very small. Your body needs just the right amount. Too little, and it doesn't work. Too much, and you can develop something called digoxin toxicity, which can cause severe nausea, visual disturbances, dangerous heart rhythm problems, and in serious cases, cardiac arrest. Now what does vitamin D have to do with this? Everything. Here's the mechanism. As we just discussed, vitamin D raises calcium levels in the blood by increasing calcium absorption. And elevated calcium levels make the heart muscle significantly more sensitive to digoxin. It's like turning up the volume on everything that digoxin does, including all of its dangerous side effects. So if you're on digoxin and your vitamin D supplement is quietly raising your blood calcium even slightly above normal, your heart may suddenly be responding to digoxin as if you received a much higher dose than you actually took. Doctors have a term for this. They call it calcium digoxin synergy, and it is recognized as a serious clinical concern in cardiology. What makes this even more alarming is that many patients on digoxin are already elderly, already dealing with reduced kidney function, and may already have calcium levels that are on the higher end of normal. Adding a daily vitamin D supplement into that equation without monitoring can push things in a very wrong direction very quickly. If you or someone you love is taking digoxin for heart failure or an arrhythmia and is also taking vitamin D, this is not something to put on the back burner. This is a conversation that needs to happen with their cardiologist or physician as soon as reasonably possible. Mention the vitamin D, mention the dose. Ask for calcium levels to be checked. Ask whether the combination needs to be managed differently. A good doctor will appreciate that you came in informed. Now here's something I want to address because a lot of people are going to be thinking this exact thought right now. You might be wondering, well, if vitamin D is so risky, why do so many doctors recommend it? And that's actually a really fair question. The truth is that vitamin D deficiency is genuinely widespread in the United States, especially among adults over 60. Studies have consistently shown that a large percentage of older Americans have insufficient vitamin D levels. The reasons are numerous. Less time outdoors, reduced skin efficiency at converting sunlight to vitamin D as we age, dietary gaps, and certain medical conditions all contribute. And the benefits of maintaining adequate vitamin D levels are real and well documented. We're talking about better bone density, reduced fracture risk, improved immune function, potentially better mood regulation, and research suggesting connections to reduced risks of certain cancers and cardiovascular events. So vitamin D is not the villain here. The issue is never about whether vitamin D is good or bad in isolation. The issue is whether vitamin D is appropriate for you specifically at the dose you're taking, given the other medications in your system. This is a nuance that gets completely lost when people just grab supplements off the shelf without thinking about their full medication picture. And this is exactly why the conversation about supplement safety for people over 60 needs to go much deeper than it currently does. Let me also address something that very few people talk about when it comes to vitamin D supplementation, and that's the issue of dosing. Because even for people who are not on either of those medications I mentioned, there is a growing concern among physicians about what's sometimes called supplementation overconfidence. This is the mindset of more is better. Vitamin D became popular a decade or so ago, and the supplement industry responded by producing capsules ranging from 1,000 IU all the way up to 10,000 IU and beyond. And many people, reasoning that they want to be healthy, are taking doses at the higher end of that range without any blood testing to see whether they actually need it. The clinical cutoff for vitamin D toxicity is generally considered to be a blood level above 150 nanomoles per liter in most guidelines, though some researchers consider even lower levels to be cause for monitoring. Getting to a toxic level from sun exposure alone is virtually impossible. But getting there from supplements, especially high-dose daily supplements taken over months or years, is more realistic than many people assume. And the risks of too much vitamin D are directly tied to the same calcium problem we've been discussing. Excess vitamin D leads to excess calcium absorption. Excess calcium in the blood affects the kidneys, the cardiovascular system, and the nervous system. For someone over 60, for someone on thiazide diuretics, for someone on digoxin, these risks are amplified significantly. The practical takeaway here is simple. If you've been taking vitamin D for more than 6 months without getting your blood levels tested, it's worth asking your doctor to include a 25-hydroxyvitamin D test and a serum calcium test at your next checkup. These two data points together give you a much clearer picture of whether your supplementation is working for you or potentially against you. There's another layer to this story that I think is worth spending a few minutes on because it speaks to a larger issue about how we approach health after 60 in this country. And that's the phenomenon that doctors call the supplement blind spot. When you go to your doctor and you list your medications, most people are very diligent about naming every prescription drug they take. But when it comes to over-the-counter supplements, vitamins, minerals, herbal products, fish oil, anything in that category, there's a tendency to either forget to mention them or to assume they don't matter because they're not prescription drugs. Studies on medication reconciliation have found that a significant number of patients do not accurately report their supplement use to their healthcare providers, and this creates a blind spot. The doctor is making clinical decisions, adjusting medication doses, interpreting lab results, all without knowing that the patient is taking something that's actively influencing their blood chemistry. This isn't anyone's fault, really. It reflects a cultural assumption that natural equals harmless and that supplements are somehow separate from medicine. But from a biochemistry standpoint, that separation doesn't exist. When a substance changes how your body absorbs calcium, how your heart responds to a medication, or how your kidneys filter your blood, it doesn't matter whether that substance came from a pharmacy with a prescription or from the vitamin aisle at your grocery store. It's acting on your body either way. So one of the most powerful things you can do for your health right now, today, is to write down every single supplement you take, the name, the dose, and how often you take it, and bring that list to your next doctor's appointment. Hand it to the doctor or the nurse before they even ask. This simple act of transparency can prevent interactions that might otherwise go unnoticed for months or years. Now I want to circle back to something hopeful here, because I don't want you to leave this video feeling anxious or afraid. I want you to leave it feeling informed and empowered, because that's the whole point. The solution to everything we've talked about today is not to stop taking vitamin D if you genuinely need it. It's not to be afraid of your medications. It's to become a more proactive participant in your own healthcare. After 60, the stakes of passive healthcare go up. When you were 35, your body had a lot more reserve capacity to absorb mistakes, whether that was a medication interaction, a nutritional imbalance, or a condition that went undetected for a while. After 60, that reserve is smaller. The margin for error shrinks. And that means the value of being informed, of asking the right questions, of getting the right lab tests done, becomes proportionally higher. So let's talk about what you can actually do. First, if you're taking vitamin D and either of the medications we discussed today, hydrochlorothiazide or any thiazide diuretic or digoxin, have a direct conversation with your prescribing physician about the interaction. Use the words calcium levels and supplementation interaction. Ask specifically whether your current vitamin D dose is safe given your medications, and ask when your calcium was last measured in a blood test. Second, consider whether you actually know your current vitamin D blood level. A lot of people take vitamin D based on a recommendation from years ago without ever rechecking their levels. Blood levels fluctuate based on season, sun exposure, dietary changes, and yes, continued supplementation. Third, take a complete inventory of everything you take, every pill, capsule, gummy, powder, or liquid supplement, and make that list part of your permanent medical record at your doctor's office. And fourth, stay curious about your own health. Not in an anxious, obsessive way, but in the way that a thoughtful person manages something important. Because your health after 60 is something worth being thoughtful about. I want to hear from you right now because this community is full of people who have real experience with exactly what we talked about today. So drop a comment below and tell me, are you over 60 and taking vitamin D? Do you also take a blood pressure medication or a heart medication? Had your doctor ever brought up this interaction to you before today? I'm genuinely curious about your experience because I think a lot of people watching this are going to feel seen when they read comments from others who were in the exact same situation, taking supplements they thought were completely safe, with no idea about the interaction. Your comment might actually help someone else connect the dots about their own health. And if you found this video useful, share it with someone over 60 in your life. A parent, a sibling, a friend, a neighbor. Because the truth is this information is not talked about enough in everyday conversations. Most people find out about these interactions only after something has already gone wrong. And that is something we can change just by sharing what we know. The bottom line is this: vitamin D is not inherently dangerous. It is genuinely beneficial for millions of people, especially as we age. But like every substance that acts on your biology, it operates in a context. In the context of being over 60, taking multiple medications, and having a body whose physiology has changed with age, that context matters enormously. The two medications we highlighted today, thiazide diuretics and digoxin, represent just the most well-documented interactions. They are not the only ones worth knowing about. The broader lesson is that supplement safety after 60 deserves the same serious, personalized attention that prescription medication safety does. You owe that to yourself. Your body has carried you through decades of life. Take care of it with the full picture in mind, not just pieces of it.